Hi, my name is Dr. Joel Collins, clinical haematologist, practice principal of the Iron Infusion Clinic. I often get asked, what is the difference between iron deficiency and anaemia? The second part to all of that is how we define iron deficiency. I talked about before it being really important that everybody's ferritin is over 30 micrograms per liter, but in fact, ferritin, or our iron stores, are affected by a lot of things, and in reality, a lot of people whose ferritin is below 50 micrograms per litre can be iron deficient, and some people who have a ferritin of less than 100 or even 200 micrograms per litre can be iron deficient. A number of different medical problems can contribute to this. That's why, as a haematologist or blood specialist, very happy to see people who have symptoms of iron deficiency, but others may have said, hey, look, your iron is fine and you're not anemic. And in fact, after our review, we can tell you confidently that in fact that person probably is. So that's why at the Iron Infusion Clinic, which is driven by a clinical haematologist, that is a blood specialist, and I train all of our staff, we actually take an end-to-end, very holistic approach as to why are you anemic if you are anemic, why you're iron deficient, and really get to the bottom of what's happening, how we can fix it best for you, and how ideally we could prevent this from happening again, or at least mitigate the need for having so much iron long term.